Dr. Nelson, I understand that at least 25% of people with cataracts also have corneal astigmatism, an irregular shape of their cornea that even with the cataract removed, if the astigmatism is not treated, would still leave them with blurred vision uncorrected. My understanding is you can do some things at the time of cataract surgery to correct astigmatism. Can you tell people about this?
Yeah, astigmatism is one of those things that honestly, most people, unless you're an eye doctor, you don't know what it means. But the bottom line is astigmatism results from the cornea not being exactly spherical. So it's not perfectly rounded. And when the cornea is not perfectly round, it's kind of more oblong shaped, like a football rather than a basketball. It doesn't focus light clearly. Okay, and so like you said, astigmatism is a common condition, and in patients who have astigmatism, if you simply remove their cataract and don't do anything to treat the astigmatism, it's still there, affecting their vision. Depending on how much astigmatism you have, that will determine how we correct it. So if you have a little bit of astigmatism, we'll correct it with what's called limbal relaxing incisions. Tiny little incisions on the wall of the eye that change the shape of the eye and make it more round. If you have a lot of astigmatism, say 1.5 diopters of astigmatism or more, it's just the way we measure it, then we may recommend what's called a Tauric lens implant, which is a lens implant that actually has the astigmatism correction built into it to get that patient their best vision. Also, the absolute latest advancement is the light adjustable lens, which can correct up to 2 diopters of astigmatism. And basically in that case, we can achieve perfection because we let the patient's eye heal for about 3 or 4 weeks after the procedure. Then we measure and see just exactly how much astigmatism is left after the healing process has completed. And then we change the power of that lens using a ultraviolet light and correct the astigmatism that way. So we can actually dial in the very precise amount that that patient needs.